Welcome to At Issue. Thank you so much for joining us. My name is H. Wayne Wilson. 10,000 baby boomers turn 65 every day in America. Currently, 1 in 7 Americans is above the age of 65. By 2035, that number will be 1 in 5 Americans. 20% of Americans will be senior citizens by the year 2035. And most importantly, 1 in 10 lives in poverty. So we need to find ways to solve some of the issues that face senior citizens with more choice, more access, things of that nature. And to have a conversation about how we can do that, we've got representatives of the Central Illinois Agency on Aging here with us. So let me introduce to you the chair of the board of the Central Illinois Agency on Aging. He is Barry Beck. Thank you for joining us, Barry.
Thank you.
Also with us is Renee Razzo. Renee is the Program Management Director for the Central Illinois Agency on Aging. Thank you for joining us.
Thank you for having us.
And also with us is Keith Ryder. Keith is the President and CEO of the agency. Thank you.
Glad to be here.
And the fourth member of our panel for this conversation, Mitch Forrest. Mitch is the Caregiver Information Manager for the agency. Thank you as well.
Thank you for having us.
And with the description I gave at the top of the program, with 1 in 10 being in poverty, that puts a lot of pressure, I'm going to use the word pressure, on the agency to provide for many of those. Is there an overriding theme for the agency? How do you approach this? Because there's so many different issues, and we're going to talk about some of those, obviously, but...
Well, one of our main missions is to try to keep people in their homes. Most of our programs are designed so we can meet their needs, staying in their home, in their community. That's where seniors are happiest, to stay in their home. And quite frankly, it's more economical to the state. It would cost the state far more for a person to go into a nursing home, and if they're on Medicaid, which most would eventually be on Medicaid, than paying for supports to keep them in their home. So that's one of our primary goals, is to help people stay in their homes. We provide nutrition, both the congregate, home-delivered meal programs. We have transportation programs. We offer information and assistance to any senior that asks. We have caregiver support programs. We have evidence-based programs to help people with their health and to stay healthy, and so I would say just keep people in their homes.
We're going to talk about some of the specifics that you mentioned, but with regard to keeping people in their homes, the good news, I guess, is that 60% of Americans who turn 65 have lived in their home for the past 20 years. It seems like an awfully high percentage, but obviously Keith points out that that's a good thing. But it also means that as they age, certain issues become more important. Meals would become very important, nutrition. How do you go about helping people who may not have the ability to get out of their home with proper nutrition, the diets that are necessary?
A lot of times we have other people who, possibly a case manager makes a referral, or an outreach worker who's been into the house and talked with the senior, and the senior has identified certain needs that are needed to remain in their home. We have a congregate meal program, which we strongly encourage seniors to attend. It helps promote proper nutrition. The meals are approved by a dietitian. They meet daily recommended intakes for nutritional value. It also, the attendance there at the site helps decrease isolation, where if many people were, struggling to remain in their homes and eating by themselves, they basically become more isolated from their community. For those people who can't make it to a congregate nutrition site, who are homebound, whether it's due to a physical chronic disease, something along that line, or a cognitive impairment, there are home-delivered meals available for that individual. They are assessed and they are approved as needing the home-delivered meals. Those are, again, nutritious meals that are then delivered by either some programs utilize volunteers if they're lucky enough to have them. Others have paid staff who then, when they deliver the meal, they engage the senior in conversation to help decrease isolation, but they also check on the senior's welfare at the same time they deliver a nutritious meal.
Does the agency help coordinate that? Because obviously there are numerous Meals on Wheels type programs, and there are numerous congregate meals. The First United Methodist Church downtown has one every week, etc. So do you
Correct.
help coordinate that? Or
We have a certain pot of funding that we utilize from different sources, whether it's state funds or federal funds, and local contributions and participant contributions. And we make funding available through a competitive process for a particular award period for our funds. And so we have providers who have applied and are been approved, and they have certain guidelines that they have to abide by and requirements. And that's how we kind of make those services, the congregate and home delivered meals that come through us, available. But we also do refer people for those meals, such as the First United Methodist Church, the Loaves and Fishes program, and other programs in the area for those people who choose to utilize those services on possibly weekdays, weekends. There's just such a large need out there for individuals where nutrition is concerned.
I think Renee hit on something which is really important for the Agency on Aging, is coordination and collaboration with other services in the community, agencies, to help us do the work that we're tasked to do to keep seniors independent. So coordinating with churches, home care agencies, other hospitals, case management agencies. We cannot do the work that we do by ourselves to cover 6 counties and over 94,000 seniors over 60 living in our 6 counties. We collaborate with others to get the work done.
And 94,000 at age 60, we're talking about, in 6 counties. I want to stay on the theme of this, the homebound situation, Barry, if I can. And it brings up the issue of loneliness, being, we're a mobile society, maybe the kids have moved to distant corners of the country. How important is it to watch over seniors, even if it's, a next door neighbor when they're homebound?
Being homebound, I experienced that with my mother to a degree, that she became very isolated in herself and depressed at the same time. And having a neighbor come over and be friendly and talk to them, or getting a meal delivered like the program that the agency has, is a big asset, because I was very fortunate to go with Representative Eunice around to the different areas like Astoria, where I'm from, and help deliver meals, and to watch when he went in with the person that was taking the meal in. We followed him, and how that person that's there is, when you first walk in the door, they're kind of sad, and they're there. That's it. There's nothing exciting or anything happening in their life. And he comes in with this meal, and it's kind of like they light up. This is a highlight of their day. And they're getting this meal and seeing this person and talking to them and having somebody come and visit with them. And whether it be on the program of 5 days a week or just 4 days a week, that has a lot of meaning. And that's the thing I really liked about the program when I got involved with the agency, on being on the board. I was on the council, and now I'm on the board of directors. But I was really impressed with what this agency does and the benefits to seniors that takes place.
And along that same line, you have the situation with mental health issues. If you have to watch for certain changes in a senior's activities. Does the agency have programs, or at least coordinate programs, that would encourage exercise, proper diet, things of that nature, so that they don't fall into the mental health issues?
Yes, we do. We have several things. We do work with the Center for Youth and Family on a program that is a mental health screening. They use a evidence-based program called Healthy Ideas. So they can do one-on-one mental health screening. The one problem with that is that there's not a whole lot of money available for that program, but we do work with them on that program. We also offer evidence-based health improvement programs such as program Manner of Balance, which helps seniors with ideas to keep from falling, because falling is one of the main reasons why many seniors wind up in hospitals and even in nursing homes, from falling. To help them be able to cope with moving around and not falling, we have programs to help them with chronic disease called Chronic Disease Self-Management Program. We have a diabetes self-management program, program activities of daily living, all evidence-based programs, which means they were developed by a national-wide, a lot of times a university. Some of these come out of Stanford University, that has proven to be effective. And many of these programs are programs that meet for anywhere from 6 to 12 weeks for 1 to 2 hours each time. And it just gives them ideas and techniques to cope.
You mentioned chronic diseases, and that's probably worth a conversation about. Senior citizens worry about different kinds of things as they age, and dementia is something that they worry about, and cataracts or osteoporosis. What kinds of programs are in place to help monitor those situations and try to find help where needed?
Primarily, one of the most important programs that we offer is the transportation program. Lack of transportation is the main reason why a lot of seniors don't go to the physicians. They may end up seeing a doctor due to an incident and end up in the hospital. They'll see a doctor and then they're told to follow up with the physician. And a lot of times it's the lack of transportation. And that's the reason they don't follow up to the physician. That's the reason they don't go to pick up their prescriptions. Possibly they don't go to the grocery store to maintain proper nutrition because they just don't have a way back and forth. A lot of times they don't have a child who still lives in the area, and they're afraid if they do that the child has their own family that they're taking care of, and they don't want to be a burden. That's why we offer transportation services for persons who are 60 years of age or older throughout our 6 counties. And we coordinate with other programs that utilize and serve seniors.
We Care or programs of that nature?
We
you
Care
coordinate
MSW
that?
projects of Henry, Illinois. We provide direct service over in northern Tazewell County in a certain corridor that's not currently being served by other transportation providers. But then again, we coordinate with local transit here in the city of Peoria and the county transit provider in Peoria County. We coordinate with Fulton County Public Service Transportation provider, with the Donated Funds Initiative provider in Fulton County. We've got vehicles that they're currently using that are our vehicles. Otherwise, they wouldn't have availability for seniors.
It sounds like the Central Illinois Agency on Agency really, one of the primary issues is you coordinate many different kinds of programs to make sure that seniors in all 6 counties at least have knowledge
Right.
of various programs.
Right. Well, we do have information and assistance specialists that they can call us, and we can help them to know where to go to get help. Some things we can help them with, or we can refer them to other organizations that can meet their needs. Many of our programs that we offer, we partner with other agencies. We are encouraged to do that. We're funded through the Illinois Department on Aging. We're funded through the Older Americans Act. And we're encouraged to partner with other agencies. And I think Renee referred to, we have a bid process. And, nutrition programs, we work with Neighborhood House and MSW Projects in Henry, Illinois. They do parts of our service area. We do parts of it ourselves. Transportation, we work with We Care and MSW Projects. We have legal services through Prairie State Legal, and we do caregiver counseling through Bradley. And
Well, we're going to talk about some funding issues in just a moment. And I also, at the end of the program, we're going to be putting up 2 websites for you to go to so that you can learn more about the Central Illinois Agency on Aging, and also a national website to find help if you are in need of that. But I wanted to go back to the transportation issue for just a moment, Mitch, and a specific situation exists in Roanoke right now. A gentleman by the name of Steve Crawford runs Roanoke Pharmacy, has for years, and he's delivered to people. He delivers as far away as Eureka, but that pharmacy is closing on December the 8th. It's the only pharmacy in Roanoke. So this is one of the problems that senior citizens face in rural areas. Lack of transportation, lack of services. How do they get to the nearest pharmacy? Or name another service that they may need, whether that be a grocery store, what have you. How do you deal with these rural issues? And everybody can join in here. I know, Barry, you have a lot of experience with rural, but if we could start with Mitch.
Some of that is again, coordinating with local agencies in those rural counties to know what might be some alternatives that could be available. Are there delivery programs that may not be the personable touch that offered in Roanoke, but extra care pharmacy that can prepare the medications and deliver them as needed, and accept Medicaid as well. Finding some other ways to help them continue to get their medications and needs if it's not available right within their community. I think we're turning to churches a lot of times also to seek help in touching their communities and collaborating with them to provide services in hard to reach areas like you're mentioning.
And Barry, with regard to rural, a senior in a rural setting faces a different set of circumstances than someone in an urban setting.
That is correct. Down where I live in Astoria, which is the southwest section of Fulton County, and down there, it's, the doctor's not really, a pharmacy's not in Astoria. So outsourcing has to be one of the main factors. If you got transportation to go somewhere to get your prescription filled, that's great. We're fortunate to have a pharmacy in Rushville, which is a few miles away, that a pharmacy, have the doctor send in your prescription, fax it to them, and then they will take and deliver prescriptions in the Astoria, Vermont, and areas right down there in the southwest corner of Fulton County, and also in Schuyler County. And it's been a big asset for us because there's seniors in Astoria that doesn't have an automobile or can't drive, and with Fulton County rural transportation, are able to get a way to get to someplace to go see their doctor, which is a big advantage for Fulton County. In the beginning, when I was mayor in Astoria, that they asked me if I would like to serve on a committee to start rural transportation in Fulton County, and I said yes, and until just last year I served on that since in the 80s. And it has happened. IDOT sets up the program, and they've experienced working with Central Agency here, and for transportation of people in the rural area, and also like in Canton, Farmington, and Lewiston, which has been a great asset for them.
And the transportation need is also critical. When we talked about doctors, pharmacies, one thing, but if you can't access a doctor, and transportation plays right into that, or lack of transportation. Is there a program that you oversee, or do you coordinate any of this so that you can reach out to doctors?
We currently don't reach out to doctors per se. There's a large number of offices that we can help coordinate so that a senior might call requesting a particular time for an appointment, but due to scheduling with the current provider, there might be a conflict. So we can call the doctor's office and assist the senior in attempting to schedule an appointment that works out for both the senior and the transportation provider to get the senior there, get them taken care of, and back to their home. You were mentioning lack of transportation in rural areas. There are a number of general public transportation providers in rural areas throughout our 6 counties. And in addition to those, they have the programs, many of those are also funded by us to do programs specifically for seniors. So they're coordinating their services, and you may see a general public rider on the same vehicle as a senior citizen, but it's basically due to funding sources, and they're trying to be as economical as possible. When people start using our transportation, whether it's general public or just the senior funded transportation, we try to explain it's not a taxi cab service. There are other people who share the service. So it's kind of a learning curve for a lot of people, you know, and you can schedule your appointment, but you might have to wait for someone else to get picked up and taken home the same time you're getting taken home. But a lot of that is just basically letting the senior and reassuring them that there is a service that can get them back and forth to get the medical care that they do need.
We've touched on funding a couple of times. Let's talk about funding. Where do you get funding for the programs that you operate?
Approximately 2/3 of our funds are from the federal government, about 1/3 from the state of Illinois. Our federal funds get funneled through the Illinois Department on Aging, and one big exception to that is our home delivered meal program, which right now approximately 70% of the funding for that is from the state and only 30% is from the federal government. The problem we're having right now is with the budget crisis the state of Illinois has, we're not getting paid. We're owed about $400,000 from last fiscal year, which actually ended June 30th of this year, funds that we actually spent through June 30th that we have not received, and then since. So there's a large amount of money that we're owed by the state, and it has really wiped out all of our reserves. Right now, we're, you know, cash-wise is very low. It's putting some of our programs in jeopardy. Biggest program's the home delivered meal program, and probably has the biggest impact on seniors. As we talked earlier, you know, that's sometimes our only meal of the day, and that's the, you know, for isolation, you know, and that's the one program that I think we'd be saddest to see in peril, because we really need to continue these programs, but it appears, you know, the state had the bond issue, the $6 billion bond issue, and it appears like they've really allocated next to nothing or nothing of that to human services. We got no money out of that, even though we're owed a lot of.
You may not see the 400,000. I mean, we all heard, or the state has a budget now, but
I think we should see it, but we don't know when, and that's part of the problem. Is they don't tell us anything. They don't tell us when we can expect it, and so it makes it very difficult for us to do any forecasting, planning, when we're just kind of in the dark.
and you do take contributions, private
We do
contributions.
take contributions, yeah. We do ask clients, you know, they are given the opportunity to donate. When we have meal sites, we, you know, have a easy little sign saying donations will be accepted, and they're encouraged. And
Let me take a moment real quickly. I want to talk on one topic for just 60 seconds, if I might, before we close out the show, and that is abuse and neglect. If you could talk a little bit about programs in place, first identifying when there's abuse or neglect. It can come in all sorts of different forms.
It does come in all sorts of different forms. Currently we have providers for all of our 6 counties that serves persons who are 60 years or older, or persons with disabilities who are 18 to 59 who can't, basically, who are dependent upon others to take care of them, provide their day-to-day needs. It can be anything from financial exploitation, sexual abuse, willful deprivation, confinement of a senior. It can be also physical abuse. There are a lot of different things that constitute abuse. It could be the grandson coming by and, you know, when he knows grandma's gotten paid and taking money for either alcohol or drugs, and then grandma's left without medication because she can't afford it. So there are a lot of different sources out there. there's a program that takes anonymous reporting of these issues, and they will send a caseworker out to check on the welfare of the senior. And the person who is reporting can remain anonymous.
And let's put up the website address so that you can jot that down real quickly here. The National Council on Aging is www.ncoa.org, and the Central Illinois Agency on Aging website is www.ciaoa.net. You'll find all the programs that they offer on that website, and there's also, I know you want me to say this, there's a place where you can actually donate to help out the Central Illinois Agency on Aging, and more importantly, helping seniors. Thank you to all members of the Central Illinois Agency on Aging, including Keith Ryder and Barry Beck, and also to Renee Razzo and Mitch Forrest. Thank you so much for joining us. And please join us again next time for another edition of At Issue. We thank you for joining us.